Hello and welcome to the third in series of World Congress of Cardiometabolic Medicine. Today we are very delighted to have Dr. Mittal at the Right Doctors platform, and I must give a little introduction who doesn't really need an introduction. He's very eminent in the field of the diabetes and endocrinologist, and he is running a department of cardiometabolic syndrome at the Delhi Heart Center, also working as a lead of the Delhi Heart and Lung Institute. So we welcome Dr. Mittal. Thank you very much for giving your time at the Right Doctors.
Thank you.
I've been listening about your talk, so it was quite interesting to learn, and I must say I'm very intrigued to find out what is this once a week insulin regime. Could you enlighten us more about this strategy?
Yeah. So as of today, meeting the goals in type 2 diabetic patient is a big challenge.
Right. Yeah.
And despite the best of the medications, only 25% of patients achieve the goals. And we have innovative insulins today available, but we have to give at least daily one injection.
Absolutely. Yeah.
So now there are trials which have been completed with once a week insulin, and that is Icodec. Now this insulin has shown in type, in most of the RCTs, onward programs are already going on, and it has shown that it is superior to daily insulin injection, one, and secondly, it is also causes less hypoglycemia, and it is as mitogenic, like no increased risk of carcinogenesis, and it has reduced 7 injections into 1. So it's to be given only once a week. Now, other thing is, there are only small changes made in the molecular structure of insulin at 3 different points. One is adding a fatty acid change. Other is, making, 3 amino acids, they are replaced by other amino acids. So that makes this insulin more stable, more, say, got a slow interaction with the receptors, and it is albumin bound in inactivated form. Once it is injected, it gets a slow release over 1 week time. The durability is 1 week, and the steady state is reached after 7 to 8 days. So after 3 to 4 injections total, the steady state is reached. And here the difference between like basal insulins, we have glargine 100 today, and then also we have a newer second generation basal insulins. Those are glargine U300 and Degludec. Okay, so those are ultra long acting insulin, but this is much longer. This is once a week, and it would be world's first acylated insulin analog, which would the action would last for almost 1 week. So insulin, like the moment when I speak to the patients, like you need to take insulin, they almost want to run away.
Absolutely.
And almost 100 out of 100 say no. So it takes time, a few weeks to months to kind of make them understand the need to take insulin. So here the once a week insulin would be available. That will take away their barriers, inertia. They would be better compliant, adherent to the treatment. So that's the only important thing.
That's very fantastic. And with the way you describe it, looks like a game-changer molecule.
Yes.
And I guess I won't be wrong in calling it as a molecule of millennium, I suppose. That probably is a brief description of it. But where do you see the future is heading to? Do you see that it is essentially meant for a certain group of people? Do you have any demographic that this group of the people will be best suited for? Will it be applicable for the pregnant women or juvenile diabetes, type 1 diabetes, or it is only for the certain group of patients without the renal involvement and things like that? So I guess there will be a lot of apprehension coming from different group of physicians and cardiologists, and obviously endocrinologists will have a different threshold to prescribe this. So where do you see the future of diabetes moving to with this new, I suppose, the molecule of millennium?
So the trials have been done in type 2 diabetic patients, and only one trial has been done in type 1.
I see.
All new molecules, because of like ethical committee clearance,
Yeah.
they are not tried generally in pregnant ladies. That's a second or third, step. So the trials have been done in type 2 diabetic patients who are insulin naive,
Right.
who are on 3 or 4 medications oral and not getting controlled. Then it is done on type 2 diabetic patients who are already on basal insulin, but they're taking daily 1 injection. So the trials have been done there, and even in type 1, children who are already on some insulin, but again they have to take daily. This is given only once a week. But as of today, it is not available. The approval is awaited.
Yeah.
Probably April 2024, FDA might approve this molecule, and then this would be available to the whole world.
Okay.
Yeah.
One last message to the population, to my colleagues who are attending the World Congress of Cardiology, and those who are watching us live on The Right Doctors. What's your message, final message to them with this new evolution, the molecule of millennium in terms of diabetes?
So as of today, if we see, there are challenges in managing diabetes. World over, the trials have shown, the data has shown that only 25% of the patients of diabetes who are on treatment achieve targets, less than 7%. So that's one point. So patients are already on 3 or 4 medications. Plus, when insulin is started, they have to take at least 1 injection a day, basal insulin, the first injection to be started generally. So here we have 1 insulin now, which would be available after a couple of months, which need to be given only once a week, which is going to take away apprehension from the minds of the doctors, that inertia, from the minds of the patients, because they would need to take only once a week. So instead of 7 injections in a week, they would be taking only 1 injection in a week. And this new insulin is as effective, maybe more effective, and has better, target in range glycemic control, as well as safety and efficacy equal to already existing basal
That seems
insulins.
like a very promising drug. And with this, I would like to thank you for your valuable time.
Thank you.
And wonderful to hear your talks.
Thank you, really, thank you.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.